All right, let's start. Good evening, everyone. Thank you for taking time to join us tonight. And on behalf of ECA, College of Health and Sciences, I extend a warm welcome to all of you. I will be your host for our webinar tonight. My name is Stephanie, student recruitment consultant for ECA Online Higher Education. Just a little bit background about myself. I have been in the education industry for the past 4 years and with ECA for the past 12 months, helping students achieve their goals and aspirations. Now, to start, let me give you a brief background as well about ECA College of Health Sciences. So, ECA College of Health Sciences is a private higher education provider delivering high quality education programs that prepare students for enhanced professional practice and leadership in their field while engendering lifelong learning and strong ethics. So today we will discuss the courses that we offer and its career opportunities waiting for our aspiring students. We will also go through our current promotions and scholarships, so please stay until the very end of the webinar. Our speaker tonight is one of the professors as well, so this will be a great opportunity for everyone to ask some questions, and I will be introducing him shortly. But before that, let me introduce our dean first. It is my honor to introduce our academic dean. Associate Professor Michelle Cavaleri is the Dean Academic at ECA Higher Education. Now, with the expertise in course designs, student support, and staff development, Associate Professor Cavaleri works with faculty to enhance the student experience and improve learning outcomes. Associate Professor Cavaleri as well has a background in languages linguistics and TESOL, and she has taught in undergraduate and postgraduate courses and work in specialist academic support roles. Associate Professor Cavalier's teaching experience ignited her interest, feedback, and academic writing development, which led to her PhD research examining technology mediated feedback. Associate Professor Cavalieri has presented her research at national and international conferences and is regularly invited to facilitate faculty development sessions at higher education institutions. Unfortunately, our dean, Michelle, is unable to attend as she is caring for her two unwell children. So we hope they recover quickly. But Dean Michelle has prepared us a short video extending her warm welcome, everyone. So please watch the video.
Hello, I'm Associate Professor Michelle Cavaleri, the Academic Dean of ECA Higher Education, which includes the ECA College of Health Sciences, or CHS as we usually call it. I'm sorry I can't join you live during the webinar today, but I've recorded this short video to introduce myself and talk a little bit about the college. I'm very proud of the ECA College of Health Sciences and our health management programs. I personally don't have a background in health. My qualifications and expertise is in education and curriculum design and pedagogy. So I look at our courses from that lens. And from my perspective, our health management programs are extremely robust in terms of their quality and relevancy and currency. As I prepared this video and was thinking about what to say, there were three things that really stood out to me that I wanted to convey about our courses at CHS. The first is that the content and the curriculum of the course itself is incredible. The units and the topics are varied and extremely relevant to give our graduates a very valuable qualification in health management and an excellent understanding of the Australian healthcare system. The course and the units have been developed in consultation with industry experts in different parts of the health sector through our course advisory committee. The course allows students to bring their prior experience and knowledge into the classroom and then build on that to extend their knowledge and deepen their understanding in the different areas of health management, and then apply that in their career in health in the future. And we know that working in health is very complex and challenging, and our program will equip you to work effectively and confidently in the industry. The second thing I want to convey about our program at CHS is the incredible educational resources and academic support services that you will have available to you. For example, all of your prescribed texts and recommended readings are freely available to you. You don't have to pay anything extra. They're all available online via our library, so you can access them 24/7 off campus at any time. We have a really wonderful learning management system called Canvas, where you'll find a dedicated site for each of your units where you can access high quality content that our lecturers have developed. You can access your readings and other resources and complete engaging activities to facilitate your learning. This is also where you can communicate with your lecturers and your fellow students in between classes. We also have a library and learning support website filled with excellent support resources about different assessment types you'll encounter, referencing, how to access our library catalogue, subject guides for specific subjects where you could access a list of resources that you may wish to use for your assessment. And you'll also find information there about our academic support events that we offer, where you can connect with our library and learning support teams and ask any questions. Our librarians and our learning support advisors are here to help you with your academic journey alongside your lecturers and your course coordinators, of course. For example, they often work with lecturers to provide tailored in-class support sessions to help you prepare for a particular assessment task. So for example, they might run a short workshop showing you how to find resources in the library for a particular assessment task or for a particular topic. Or they might show you an example of an assessment type that you will need to produce, and they'll talk through what it looks like and how to prepare it. You can also book individual appointments for one-on-one support with, for example, again, finding resources for an assessment or understanding an assessment task, or for help writing academically, or for understanding how to reference correctly. All of those skills that often take us a little bit of time to learn. Our librarians and learning advisors are an incredible team, and that one-on-one support from them and that individualized attention and support is something that you don't often get in larger institutions. So we're very lucky to have that available for our students at CHS. And the third and final key aspect of CHS that I want to convey to you is our incredible academic team. Our lecturers are extremely highly qualified, and most of them hold a PhD. And they're also very experienced in the healthcare field. Some of them are medical doctors or other types of medical professionals, and most of them are actively engaged in research in the discipline in the various areas of healthcare. They bring that experience and knowledge into the classroom so you can learn firsthand from these professionals and these academics, which is exactly what you want when you undertake a course like this. You want that connection and guidance from somebody in the field that's very experienced and very highly qualified, and that's exactly the kind of staff that we have here at CHS. So my colleagues will no doubt talk to you more about the specifics of the course and the support and the staff, but I hope that's given you a good overview about what you can expect at CHS, and I really hope you join us, and I look forward to meeting you one day.
All right. So that's our Dean, Michelle. And now it is a great honor to have him here as our speaker to give us a better understanding of health management courses. Now, over 20 years, Dr. Khalifa led multidisciplinary healthcare and information technology teams to develop and implement evidence based solutions to direct healthcare strategy and operations of healthcare services. Now, using health analytics and business intelligence, Dr. Khalifa led diverse projects enhancing patient safety, healthcare effectiveness, efficiency, and timeliness. Over the last 10 years, Dr. Khalifa published over 50 journal papers and book chapters and was granted an innovation patent from IP Australia in 2018. Now, please help me welcome our professor and director of studies, Dr. Mohamed Khalifa.
Thank you very much, Stephanie. It's my pleasure to be here with you today. My name is Mohamed, and I'm the course coordinator and director of the Master of Health Management at the College of Health Sciences. My background is medicine. I'm a medical doctor by background. And I did many qualifications. I did my master's in health informatics at the University of Edinburgh in Scotland. I did my PhD at Macquarie University here in Sydney in health innovation and evaluating clinical decision support systems. I have been teaching health management for almost like 22 years now. And at the same time, I was also a manager, a health manager in hospitals, responsible for projects of improving the effectiveness, efficiency, timeliness, and patient safety in diverse types of healthcare services and levels, including primary care, secondary care, and tertiary care. I also published most of these projects to share my experience and my approaches and methodologies so that everyone else in the world, around the world, they can use these evidence-based approaches and strategies. So it's my pleasure to welcome you today to this orientation session about the college and about our programs. So we can move now to the next slide, please, Stephanie. In the next slide, I'm showing you here our design of the three programs. We have a graduate certificate in health management and a graduate diploma in health management and the Master of Health Management. So for you, all of them will be delivered online. The point is these three programs are designed in a nested three levels, which means that when you complete the first 3 units, you can graduate, you can exit the program or graduate with a certificate. For those who can complete the 6 units, the first 6 units, they can exit the program and graduate with a diploma. And then for those who will complete all of the units, which are 12 units, they can get their Masters of Health Management. So the whole program is composed of 12 units, and these units are designed in a nested way. So we have 2 exit points after 3 units and after 6 units, and then the final graduation with the master after the completion of 12 units. Now, when we look to the next slide, we can find more details about each of the 12 units. Next slide, please. Yes. So the first unit is an introduction to the Australian healthcare system and the challenges facing healthcare systems. The second unit also talks about clinical governance, quality, and safety in healthcare. The third unit is about leadership and management in healthcare. So these are the first 3 units that represent the graduate certificate. And then Unit 4 is focusing more on evidence-based practice in healthcare. So you will be learning more about the different types of studies, the different types of designs for research in healthcare. And then you will learn in Unit 5 about information technology and management in healthcare. The 6th unit is about leadership and collaboration in the practice in healthcare. Then these are the first 6 units, which represents the graduate diploma. Now, for Unit 7, you will learn more about change and managing the change in healthcare, which is very important. And then Unit 8 about strategic and organizational planning for healthcare organizations. And then Unit 9 is about the finance and economics of healthcare systems. And then Unit 10 is focused on the health statistics, epidemiology, and critical analysis. In Unit 10, we will learn more about developing KPIs of measuring the performance of hospitals and other healthcare organizations, and at the same time understanding how we correlate that to the epidemiology science and knowledge and turn that into an implementation within the healthcare context. The last unit, Unit 11, is equivalent of 2 units. This is why the program is considered 12 units, but actually the last one is a double unit. This double unit is a capstone project. The capstone project or the capstone unit will enable you to work in a small team of 3 or 4 candidates together to come up with a project to overcome one of the challenges in healthcare. For example, you could do your project or your capstone in implementing technology in healthcare, using artificial intelligence in healthcare, improving patient safety, improving leadership, improving the adoption of evidence-based practice in healthcare, and so on. So these projects will enable you to implement what you have learned through the previous 10 units into an actual case study within the knowledge of the healthcare. You can also link that to your background specialty. If you are coming from a nursing background, if you are coming from a medicine background, if you are coming from management or technology background, you can represent that and show that in your capstone project. Yeah, the next slide, Stephanie, please. Here you can see how these 12 units are distributed. So as I mentioned, the graduate certificate includes units 1, 2, and 3. The graduate diploma includes units 1 to 6, 6 units. And then the next slide, please. The masters include the whole 12 units. Yeah, the previous one, yes, okay. The next one, yes, thank you. So the master program includes all the 12 units. Next slide, please. Now, let's talk about the career pathway, because most of the students would ask, what exactly is my career opportunities and what are exactly my chances of like developing my career? So we have almost, let's say, 2 types of pathways or 2 major pathways. One of them is a complete career shift. If someone is coming from the clinical nursing, for example, and then they would like to become a health manager, which is not really 100% a continuation of nursing, but it's like a career shift. Then you will be qualified to gain the knowledge, the perspectives and skills and ability in the areas of overcoming the complexity of healthcare challenges, governance, safety, quality, and so on. Other people would be, instead of shifting their career, they would be interested more in getting promoted into their career. For example, if I'm a nurse, I would like to become a head nurse. So this kind of qualification, the graduate certificate, diploma, or the masters, can help me easily to acquire a new level of job and implement the skills and knowledge that I have in the same area that I was working in when I was a clinician. So these are the major 2 pathways. So in all cases, graduates will also understand and grasp the advanced skills of evidence-based practice, economics and finance, strategic planning, epidemiology, statistics, developing KPIs, strategic scorecards, developing operational dashboards, implementing health information systems and electronic health records, and so on. So the successful completion of health management qualification will prepare our students to gain the required skills and knowledge to get themselves a good managerial and leadership role in different fields of healthcare, including primary healthcare, secondary healthcare, hospitals, medical centers, aged care facilities, planning, government agencies, and Department of Health as well. Whether in Australia, if you are planning to come to Australia, to stay in Australia, or you already have the residency in Australia, or for our other international students when they plan to go back to home countries or travel to other countries using the Australian qualification. So back to Stephanie. Thank you very much, Stephanie.
Thank you so much, Mohammed. All right. So, everyone, I know you have a lot of questions. So, please stay. You will get to have a chance to ask later on.
Sure. Thank you.
All right. Now, let's review the fees and charges for our postgraduate health management course. Now, the standard fee for our Masters of Health Management is at $31,200. Now, we offer a limited number of scholarships for our eligible students, providing a total of 8,400 towards your course fees. Now, this reduces the cost to 1,900 per subject for the 12 subjects required for the master's program. Now, the fees for the program as follows. So that would be for our graduate certificate and graduate diploma. For graduate certificate, it's 7,800 consisting 3 subjects at 2,600 per subject. Now, our graduate diploma in health management costs 15,600 consisting of 6 subjects at 2,600 per unit. Now, please note that scholarships are currently not available for the graduate certificate in health management and graduate diploma in health management. Fee Help. Now, ECA College of Health Sciences is registered provider for Fee Help. Australian citizens have the opportunity to apply for a government loan to cover their tuition fees, and here's how it is. During the application process, you'll complete a form to request the government loan. Repayment begins once your income exceeds the fee help income threshold. Now, the fee help loan is allocated when you enroll in subjects. For instance, when you start your course on the intake date, the tuition fee for the first subject including the scholarship, so that would go down to 1,900, it will be added to your fee help loan. Now, after completing the first subject, you can choose to enroll in additional subjects, such as the second or second and third, depending on your preferred pace. If your income surpasses the threshold, a specific percentage of your income will be used to repay the loan to the government. Now, the system ensures that you can finance your education upfront and repay the loan throughout your taxation once you are earning a sufficient income. For more information, I have flashed here the website of studyassist.gov.au. Now, ECA College of Health and Science also have a promotion. So students who will enroll for our upcoming intake will receive a 12-month complimentary subscriptions to ECA Online Skill Builder short courses and Employability Advantage. ECA Online Skill Builder short courses are a great way to enhance soft skills needed in professional environment. Completing short courses in leadership, interpersonal skills, and creative problem solving will help you as well. Now, Employability Advantage offers essential tools and resources to help students launch their career and gain the confidence and skills to succeed in the professional world. For our intake date, trimester 3 will be on September 30th, 2024, and we will only be receiving applications until 27th of September. So let's go through the admission requirements. Our Master of Health and all of our courses has entry requirements. Now, in the Masters, base is on the following requirements. Recognized bachelor's degree equivalent to Australian Qualification Framework 7 or equivalent, or if you have higher qualification in the health-related discipline, or if you have successfully completed any CHS, graduate diploma, or graduate certificate. Now, alternatively, for academic requirements, students who do not meet the entry requirements for the Masters of Health Management may use the successful completion of the graduate certificate or graduate diploma. And if you do not meet those, you can actually enter still by having a minimum of 3 years relevant work experience in health related field. The relevant work experience must be demonstrated throughout your CV and a statement of service confirming the dates of employment and the position held within the organization. Now, admission requirement for our graduate diploma in health management. It's either you have a recognized bachelor degree equivalent to AQF 7 or higher in the health related discipline, or if you have successfully completed the graduate certificate in health management. Now, alternatively, if you have a minimum of 2 years relevant working experience in health related field, and again, health related or sorry, work experience must be demonstrated again throughout your CV and statement of service confirming the dates and the position you held within the organization. Now, lastly, admission requirement for our graduate certificate. If you have recognized bachelor degree equivalent to AQF 7 or higher in the health related discipline, and alternatively, if you have minimum 2 years experience in the health related field, again, the relevant work experience must be demonstrated through your CV and statement of service confirming the dates and employment you held within the organization. Now, this is what everyone is waiting for. I now open the floor. I know you have questions. Mohammed, we have a question. What's the unit structure?
Yeah, okay. The unit usually, each unit is delivered over like 12 weeks of studying. So if you are studying full time, then you can study up to 3 units each trimester. So each trimester is 3 months, which includes 12 to 13 weeks. So the study extends over 12 weeks. If you are studying less than 3 units, then you are part-time. So you can study 1 unit each trimester, each 3 months, or 2 units up to 3 units per trimester to be full-time. Now, if you are studying part-time, you can start with 1 unit or 2 units. Now, the structure of the unit is 12 weeks. Each week we study one module. The module is made of 1, 2, or 3 topics. For example, in the unit of the health informatics or the health information and technology, the first module is an introduction to technology, and then the second module is about health information standards. The third unit is about electronic health records and hospital information systems, and so on. So each week you will be studying one module. Now, during the unit, you have 2 or 3 assignments. So most of the assignments are narrative assignments. We don't have exams. We don't have multiple choice questions. We don't have short essay questions. We have assignments that you need to write in the form of a narrative assignment that you write on a Word document, and then you upload through the Turnitin system, which is connected to the Canvas learning management system. The assignment reflects the modules covered. For example, if we have an assignment by week 4, then it is almost focused on only the first 3 weeks, and so on. Now, I think this covers the unit structure, right? If you have further questions, just ask them. Now, how the course is delivered? The course is delivered online through Teams, like this one, or Zoom link, whatever. And then we have a 2 hours workshop every week for each unit. So if you are studying 1 unit, then you have 2 hours each week. If you are studying 2 units, then you have 2 hours for each unit. You have 4 hours workshop every week. They could be in the same day or in 2 different days. For the purposes of those, to make it more compelling and more suitable for those who have full-time job, we can do all of the units for the online students during the evening, 6 to 8 p.m. Sydney time, or 7 to 9 Sydney time in the evening. So during the workshop, what we do is We dedicate 15 to 20 minutes to go over the material of the week, of the module, and answer the questions that could arise after you study the module or the weekly material of the unit. And then we dedicate 10 minutes or 15 minutes to go over the assignment, the next coming assignment, when we are close to the date of submitting the assignments, the due date of the assignments. And the rest of the 1.5 hours or 1 hour, we cover the workshop activities. The workshop activities are 3 activities or 4 activities based on the designed workshop. The designed workshop is usually about discussing and implementing what we have learned in the week of the week material, of course. So as students, you have to read, you have to study, you have to, so reading and studying can be done all using Canvas learning management system. So in the Canvas, when you get the access to the Canvas, you can view the recorded lectures, you can read the reading list, you can read a paper, you can watch a video, you can watch resources, get resources, and do the study in addition to implementing what you are learning in the 2 hours workshop. Okay, so this is how the course is delivered and how many days. Yes, so it's if it's only 1 unit, then it's only 1 day, 2 hours. If it is 2 units, we can do that in 2 separate days or in the same day, but this could be like a little bit too much for some people. Would say that I can't really attend 2 hours plus 2 hours in the evening. That would be too much or too much information for me to grasp in 1 day, especially that this is after hours and in the evening. So that might be for 2 units, it might be better to make it on 2 separate days. Now, could you explain the assessment and do we have exams? No, we don't have exams. We have assignments. The assignment is writing on a topic, writing about a topic, writing, designing a strategy or doing a review of literature, designing a plan for improving patient safety, criticizing or providing critical review of literature about a topic such as challenges of implementing systems in healthcare and so on. So these are the assessments. The assessments are assignments, not exams. Okay, for those who are working full-time, they might prefer to do 1 unit each term, each trimester. So you can finish 3 units each year. Then you can study continuously, but 1 unit at a time, one unit each trimester. But this will make, yeah, that's fine. That's fine. She's at work. I think, yeah, that's fine. So, but that will make the master take like 4 years if you are studying 1 unit each trimester, because you will be able only to study 3 units each year. Now, maybe you will join 1 unit first trimester and then decide to do 2 units second trimester. And then 1 or 2 units third trimester. So you could finish 5 units the first year. Then you could finish 4 units the next year and then 3 or 4 units the last year. So you can study the masters in 4 years, 3 years, or 2 years. So the full-time load will allow you to finish the masters in 2 years or even less if someone was completely free and dedicated to study. So it is a 2 years program designed into 4 years part-time. Yes, if you are enrolled in 1 unit, then that's fine as a beginning. It's advisable that you start with 1 unit, but then next trimester, you can plan to join 2 units. We can offer 2 units. So if you are now enrolled into 1 unit, for example, let's say unit 2 or unit 1, then next trimester, you start 1 unit this trimester, which is, for example, this second trimester of the year. And then the next trimester, you can study 2 more units. Then you finish the first 3 units in 2 trimesters. Then you can either have a break for 1 trimester, 3 months, or you continue your studies with another 1 unit or 2 units and so on. So we have the flexibility.
If you have further questions and if you're currently busy, you may directly contact me. This is my email, stephanie.binag@eca.edu.au. I'll be more than happy to provide a quick consultation. And of course, the one who will help us answer any questions, we have Dr. Mohamed Khalifa.
Anytime. Thank you very much, Stephanie.
Thank you so much. All right, that's it for tonight. On behalf of ECA, thank you so much for taking your time and attending the webinar tonight. Also, thank you so much, Dr. Mohammed, for being with us here.
It's my pleasure. It's my pleasure. And hope to see all of you in the next
Yes,
intake. Yeah.
intake.
Thank you very much. See you.